Okay, guys. Hi. So we talked in the past discussing Shen disorders, right? So we talked about schizophrenia in the past. We talked about ADHD, for example, and the notion of these being sort of disorders of the Shen, right? Showing up in different ways. We do have to acknowledge that the Chinese literature doesn't have a lot of really deeply nuanced conversations around the Shen, right? So because in the end it's a more of a practical approach, just saying like, look, despite how wildly different these different Shen disorders can show up, the underlying factors in them are consistent. And so it's not necessarily, just from a purely practical perspective, it's maybe not necessarily all that useful to get really, really down in the weeds around, all these different really wild nuances. And it may be also that, the things that we see today just weren't as maybe as common back then, when these discussions were occurring and stuff. So, if things weren't occurring all that much, like so much anxiety, like how we deal with now, and the different permutations of anxiety and presentations of anxiety, it's just maybe it wasn't happening as much. Like they don't have these long arguments about different, having all, like, again, these subtle, nuanced conversations around this. It's more practical, right? So this is, in a sense, the beauty of Chinese medicine is the practicality of it. The conversations that we have around these things are very practical. What that comes up against, though, is in the West, we're a little more obsessed with ourselves. We're a little more psychology obsessed. We're a little more psychoanalytically obsessed. So we start to wonder about these things. So you get things like the Worsley tradition, where that the word, I think the main value of the, possibly the only value of the Worsley tradition really is it is a really good attempt to bring more discussion of a more technical type of psychology. So using psychologically technical terms and being more nuanced in discussions around what constitutes Shen disorders, around what constitutes different elements and how they show up, and different disorders and the like. So the Worsley tradition really is a truly Western acupuncture tradition that attempts to bridge that gap a bit, and I do find that part of it interesting. Um, Today, let's have a look at something a little bit different than what we've talked about before. When we looked at schizophrenia, we were saying, like, look, what's happening here is that the Shen has a disorder wherein, there's things like paranoia coming out, there's things like delusional thinking coming out. But one of the things that you find that's occurring here is the presence of the Shen sort of hyper connecting to information, which is quite interesting. Everything they see is about them from a more paranoid perspective. Things become very small, things become very meaningful in that way. And this is true for paranoid schizophrenia, but it's also true in a different way for things like process schizophrenia and these kinds of things, where small things get blown up into very, very large, significant, things, emotionally significant, cognitively significant. So it's quite interesting, right? So then the degree to which there's the presence of phlegm and then these questions, then you get things like almost kind of the opposite of this, in a sense, is like inattentive type ADHD, where the Shen is almost kind of underfunctioning and failing to connect with things around, in from a more cognitive kind of intellectual sense. So the inattentive type ADHD is more of the spaced out type. So they're kind of almost not taking in any information in a sense. A little bit different from, say, ADHD. Well, the hyperactive type of ADHD, I should say, a little bit different there. But yeah, well, in that case, we did say, right, that the presence of phlegm in just pure hyperactive type ADHD tends to produce more intensity of symptoms because the phlegm, the insubstantial phlegm in this situation, kind of has an obstructive factor to the qi flow. So we're saying that underlying this hyperactive type ADHD is this liver stagnation, ultimately often turning to heat, typically turning to heat. And the presence of insubstantial phlegm is just another obstructive factor to the qi. So for a frustrated irritable, even angry kid with a diagnosis of hyperactivity, most of that stagnate. The main two sources of that stagnation are going to be their physiology, meaning their constitution. So woody kids, most typically, they're kind of just built for it and are prone to stagnation, and that's part of their nature. And also then parenting or upbringing. So environment, right? So this is sort of the nature and nurture question. So that'll be the secondary area where then where that sort of underlying physiology sort of gets challenged. Let's say with over discipline, just parents having a hard time with a spirited, spicy kid, and responding with over-discipline, or at least the perception of over-discipline, then ultimately leading to lots of liver qi stagnation. But what we were saying previously was that then also the presence of insubstantial phlegm provides another avenue of qi stagnation, in the sense that the insubstantial phlegm is an obstructive factor. Okay? Now, today, what I'm interested in talking about, since we had this kind of running theme with this, is, of course, autism. Right. So this is a very common thing to see. It's being diagnosed more and more. Of course, I treat only kids now, and I treat a lot of autistic kids because the parents of autistic children reach out for quote unquote alternative care at a much higher percentage than parents of kids with even hyperactivity or even asthma or just digestive complaints. Parents of autistic children look for care outside of the doctor, right? And the reason for this is that it seems to me like most of the energy in Western medicine around autism is going into diagnosis, in the sense of like determining risk factors and starting to develop instruments with more subtle instruments of diagnosis. Right. So typically the average age of diagnosis is typically around 4 years old once the kid enters a TK/preschool sort of environment, and the socialization becomes much more obvious, or the lack thereof, that is. And so then that's when the diagnosis is happening. But you're starting to see more and more diagnostic instruments that allow for earlier and earlier diagnosis. So that even in theory, the parents could get a questionnaire before they're even planning to get pregnant, because there's so many risk factors that are occurring, or there's some number of risk factors that are occurring before the pregnancy even begins, that would tell the parent with some degree of accuracy the likelihood that their child is going to be born autistic. For example, do they already have a child, especially a male, with autism? Having a previous child, a male child with autism, puts you, I think, at 50% risk. If the next child is a male, it's a 50% chance that kid will also be autistic right off the bat. If the parents are older, so mother or father, as they get older, just the autism rates go up. Right. So these are things that, just knowing that. So these are things that, what I'm saying here is that these are things that Western medicine has been researching and recognizing as risk factors. We're not talking about causative correlation, any of that. We're just talking about risk factors. So knowing that that's going on increases by a certain percentage the risk that a child will have autism. Right. There are even environmental factors like living in areas with higher rainfall. Right? I haven't told you what causes autism yet, but this will get interesting in a minute. Living near freeways or in cities, metropolitan areas with higher air pollution. Exposure to pesticides during the pregnancy, or even previous to the pregnancy, if the mother is carrying these chemicals. Fever during the pregnancy can lead to higher rates of autism. We know that Tylenol during the pregnancy leads to more valproate, different kinds of drugs, antidepressants, and many, many kinds of drugs. The more the mother takes during the pregnancy, the higher the rates of autism are. If the mother gets gestational diabetes, if there's issues with fetal presentation, umbilical cord complications, fetal distress during the birth, just having multiple kids, right? Whether or not they have autism, things like maternal hemorrhage, Rh incompatibility, for God's sakes, hyperbilirubinemia. I mean, the list just goes on and on. Even the maternal migration from one country to another during the pregnancy increases autism rates. So, insecticide exposures, fertilizer exposures, maternal gut health. There's many, 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 many things here. Kids born in the summer, birth injuries, traumas, low birth weights, low 5-minute APGAR scores, meconium aspirations, neonatal anemia, preterm births. The list goes on and on and on. I mean, I don't even have them all in front of me. It's just what I can remember. So what is happening then in Western medicine is a lot of research has gone towards risk factors, and which is amazing. It's very, very interesting to do this research. It's great for us to start to pinpoint for ourselves, what do we think is quote unquote the ultimate cause of autism? Full genetic research. There's many, many genetic mutations. And so the leading thought process is generally that you start with some amount of genetic mutation, and the more genetic mutations there are, the more serious the genetic mutations are, then that leaves the child vulnerable then to some kind of insult from the outside. So the interior, based on the genetic mutations, the interior is somehow weakened, and then you get pesticide exposure. Because two kids could have pesticide exposure, but one of them is autistic. Why? Because of that genetic background. So the stronger the genetic background is, the more pesticides they could be exposed to before then it causes autism, in theory, right? So certain kids, but some kids could get pesticides and get something else. Why autism? It seems to be a genetic question and an anatomical question ultimately, So anyways, these notions of then what happens is that the doctor then says, okay, we have these risk factors. So the parent could take a questionnaire before the pregnancy, at birth, after birth, in the first year, in the second year, and the doctor could, with reasonable, depending on the instruments, suspicion say, look, your kid is 37.8% likely to have autism. And the reason that they like this thing is that because the earlier you get a diagnosis, the earlier you can intervene with treatment. Now, where this is kind of where the disconnect is that there's not research into treatment particularly, except to find out that existing treatments don't generally work, except for things like applied behavioral therapy, speech therapy, occupational therapy. These things do help. But are they really getting to the source of the thing, right? They help, but are they getting to the source, right? But I think probably all of these risk factors, what it shows us is that autism is complex. It's a very complex presentation physically and anatomically, physiologically. I mean, the brain has gone through so many changes so that by the time you look at an autistic child's brain, let alone an adult, there are many anatomical changes that have occurred that it's not my expectation that I'm going to reverse that anatomy per se. I mean, as you catch them young enough and you give them enough treatment, and maybe they can either those parts of the brain will grow or change or become less inflamed or smaller or bigger or less connected, more connected. All these things that as you treat pathology, that those brain areas will get healthier as they develop. This would always be the hope, but it's a lot to go against when the anatomy is already, you're at a deficit with the anatomy. Then the physiology, how all those things are interacting with each other. This is also an incredibly complex question because it's not just brain physiology, but now you're getting into things like gut physiology, how the gut is operating. And that's one area besides therapies that the doctors can, that I've heard a few doctors at least recommend to parents, although this is not across the board what's done. There is good research indicating that gluten-free and casein-free diets are very helpful for these kids. So more and more, very slowly, these doctors are recommending that. But even in those cases, the parents are dissatisfied with what they're being given, right? So then that's why they find us, okay? So let me give you the headline here. From our perspective, autism is insubstantial phlegm misting the mind. That's what autism is. It's insubstantial phlegm misting the mind. And there's a number of ways that this shows up, right? Based on autism from a disorder perspective and the types of symptoms that they show up with is a very complex situation. We consider it a spectrum, so that different kids show up with very different ranges of symptoms. And there's a number of factors from our perspective that play into this. So the first and most important, I think, factor to think about in all of this is insubstantial phlegm misting the mind, veiling the heart orifice. The reason for this is there's a couple of different reasons that this is true. One reason for this is that autism at its core, in a sense, is a sort of social disorder, in the sense that one thing across the board with autistic children and autistic adults is difficulty with communication. Okay, so things like language, right? Very often there's just no speech at all, right? Very often in more serious cases. But even when they are speaking, they can be difficult to understand, or the way they use language can be a bit different, or difficult to follow. But the underlying factor here is that the insubstantial phlegm, I think the word veiling is interesting. It's a veil. And I think in a way, the way that a veil filters out light, the veil of insubstantial phlegm is there filtering out social information. So, for example, one of the things that's very commonly observed with autistic kids and adults is they have trouble recognizing facial expressions. So the difference between a smile and a frown, okay, they actually have trouble differentiating between those two. This is social information. It tells you how somebody feels. It gives you a clue as to what they're thinking. And any kind of nonverbal communication is very difficult for them to interpret. Hand gestures, body stance, body language, things that might clue me in to the fact that somebody's bored when I'm talking to them and I've cornered them at a party and I'm telling something I'm interested in, they can easily signal to me that they're bored, right? Any number of ways, not engaging, looking away, yawning, shifting their posture a lot, whatever it is. I would pick up on that and move on, right? Change the subject, ask them questions about what they're interested in, stop talk, whatever, right? I modulate my behavior based on that social information that's coming in. They don't see that social information. They have a hard time understanding at an intuitive level what that social information is. So in some cases with behavioral therapy, they learn to interpret those body positions and different body language, that they have to sort of memorize what it is. And in the case of facial expressions, sometimes they see it and then have to interpret it sort of like you would like on a flashcard or something like that, right? Or in a lot of cases, in more severe cases, they just don't register the differences. So that social information is being filtered for them. When you speak to them, a lot of the subtlety of language will be lost on them. tone of voice, inflection, the rising and falling of your tone that indicates what you're actually feeling about what you're saying, and, giving emphasis to things that you're saying or de-emphasizing something, or all of these really subtle things that we do as pack signaling animals, or as signaling pack animals, verbally signaling pack animals. Can be very difficult for them to parse out all of this relatively quite subtle information, right? So this, again, all of this social information is being filtered, right? Even things like, it's so interesting, like things like phrases like, "Oh, we're up a creek," and these hyper literal interpretations, right? Even to that, like, what do you mean we're up a creek? What does that mean? We're not in a creek. We're not anywhere. No. It means, oh, okay. So these kinds of things. So this filtration of social information, so that they're not sort of reading other people, individuals or groups, in a way that is sort of agreed upon as a culture, how the way that we agree to sort of operate in that sense. So they're operating at that deficit. So in that case, then the information coming in, they're not interpreting that information. So difficulty with communication is part of it, is that filtration, it's coming in. But the second thing is that also remember that when we're having an interaction, like even through a microphone, I'm talking and you're listening, in a sense, our Shen is reaching out. And sort of when you talk to somebody in any context, your Shen reaches out and interacts with their Shen. Right? So even through this medium where it's not live, you can hear what I'm thinking, you can hear what I'm feeling, if you could see my face, you would even understand more about what kind of person I am under the surface here, and little things that I might give away in terms of what I think is funny or what annoys me, and all this information that you get out of me just through this medium. That's your Shen. Your Shen is reaching out and interacting with that information. Or that information is coming in and interacting with your Shen, so to speak. So that's then how this is going, right? That then is how this is going. So this all of this is going together to create a situation then where that information is not coming in. But where the veil also occurs is that, in a sense, the Shen is not able to reach out. And so what you get is, not only do they have difficulty with communication, but also that they do not want to communicate. So the Shen, they get what some psychologists call egocentrism. And not like, oh, he's so egocentric, like it's some pejorative term. No, it's like a technical term, egocentrism, like they're sort of stuck in the interior. They're sort of self-obsessed, but again, not in a negative way. They are just doing their own thing. And so you get things like avoidance of eye contact, right? So then not reaching out. So parents have a hard time drawing these kids out. They ask them questions, they try to engage them, and the kid, a lot of they're just not interested in that. The kid's just kind of interested in what they're up to, right? And depending on how high functioning or low functioning they are, their interests will vary, right? So this creates then this, okay, so this situation, okay. So you have a lack of information coming in, you have the Shen not moving outwards, but then the presence of this insubstantial phlegm also acts then as an obstructive factor to the system, to the chi mechanism. So that in a sense, they get a lot of chi stagnation from this. So, and these kids are pretty notorious for being difficult, obstructionist, the oppositional, they don't want to do something, they don't want to do it, right? They don't want to transition from one thing to another, they don't want to do it, right? So this notion of then, it's kind of this chi stagnation question that shows up for us as like kind of liver chi stagnation. Okay, that's part of it. But then also with this obstructive factor, there is also typically a lot of heat in the interior. So they're often driven as if by a motor. I mean, they just can't stop moving, right? So physically, they can be elopers, where they go out the front door and just wander off, right? Many things in the news about autistic kids and so that are lost, and you have to go and find them. They're just moving all the time, and even when they're still, their mind is moving. They're active. It's not common for them to be still. Very difficult. That heat, they can often. Typically, autistic kids are good sleepers, but sometimes they're not. Right. So. It's an interesting question why they would be good sleepers. These start to be questions. But so you have social information's not coming in. So it makes it very difficult for them to read the world. Number two, the Shen is obstructed. The Shen is blocked from moving outwards. And the way that shows up for us is they don't tend to even want to engage the world. Now, of course, I should say this. In this being a spectrum, there's a lot of autistic kids, higher functioning autistic kids that want to engage the world. So not all these kids are always showing up the same, right? So maybe I'm just giving a very specific example here of more typically lower functioning autism, right? These things start to be more flexible when there's higher functioning autism in question. But in general, kind of stuck inside, wanting to do their own thing, not wanting to be bothered by other people generally. They tend to want them around, but they don't want to be bothered by them. And then the presence of a lot of interior heat. This is another one. So that drives their behavior, these kinds of things. And that's where you get, and then the chi stagnation that goes along with this, right? So we consider basically that it's the spleen that creates clear thinking, right? So when the spleen is strong and it's sort of clear, it's what's called the clear yang of the spleen, rises into the mind and creates sort of what we consider sort of clear thinking, practical thinking, realistic thinking. So it's like, let's be realistic about what the world is and how things are going in the world and my relationship to the world. The spleen creates realistic thinking, right? And so where this then can get obstructed is that, as a culture, we consider, sort of autism, it's not sort of clear thinking, right? It doesn't represent, because these kids are not, in lower functioning situations, depending, we can make that judgment because a lot of the times these kids don't grow up to be independent adults who can watch themselves. And this is a difficult part for the parents. Like the parents are saying, look, I'm not going to be around forever. What's going to happen to my kid? Are they going to be institutionalized? How is this going to go? Right? So when they come to see me, they're just trying to figure out, how do I get my kid to be more independent? Right? So then at its core, because the headline of this is the phlegm, then at its core, in a sense, this is a spleen treatment. Because in a sense, then the obstructive factor of the phlegm blocks this clear thinking, right? So this can show up in any number of ways, as part of phlegm. When phlegm is present in mental and emotional disorders, mental health disorders, you get delusions. This is not clear thinking, right? It's one thing to be anxious, some, let's say, deficiency heat driving the heart just can't stop. And the heart wants to engage, so it's engaging something. And then it just drives and drives and it can't stop. And then that's anxiety. It's a pathological heat affecting the heart, not a normal yang process. This is heat now. It's a term of pathology. And so then the thinking is pathological. But anxiety is at least rooted in something that we can agree upon, at least is rational to some degree. The obsession with something may be irrational. You're like, oh, she didn't take her jacket, she's going to be cold, and then you just can't stop thinking about it. I mean, it's a silly example, but it's the idea is that at least at its core, there's some rational notion that we can at least be like, well, yeah, but you're going too far with it, maybe. Okay, and this is driven physiologically in Chinese medicine by these different sources of heat, right, affecting the heart. But where phlegm, insubstantial phlegm is present, then that's where delusion begins. I mean, then it's like, this is anxiety, but this is anxiety about things that not one person would agree is true, right? Just no, it's not. It's highly unlikely that the government is targeting you. It's unlikely to the point of irrational, right? So then, okay, it's just going too far, right? There's just no evidence outside of the way that you're seeing something or hearing something. Eh, this is the way we deal with this in a modern context, right? So that means that the basic treatment for autism then is, because phlegm is the fundamental factor here, spleen is the organ related to phlegm, strengthening the spleen and clearing phlegm. Right. So we have herbs in Chinese medicine that clear insubstantial phlegm. We have herbs that strengthen the spleen. Right. So irrespective of what the other presentations are, liver qi stagnation, interior heat, even deficiency heat, you start seeing a lot of things like sensory processing stuff going along with this, and fear responses, these kinds of things indicating probably the likelihood of more deficiency heat, even a lot of anxiety, which would typically strike me as more of a deficiency heat type of situation. Irrespective of that, the underlying treatment for all of this is through the spleen, to clear that phlegm. As that phlegm clears, the obstructive factor that is causing the liver qi stagnation begins to decrease. The obstructive factor that's sort of trapping heat in the system starts to decrease, right? It clears up the mind and creates more, consensually realistic, realistic thinking, right? That society agrees upon as realistic. So, I guess since I'm thinking about it, I should say, there are a lot of situations, or not a lot, but, you get people like Temple Grandin who say, look, autism is not a pathology, it's just a different way of thinking. And fair enough, for a high functioning autistic person who can be independent to some degree, that's all reasonable. It's a reasonable way to think about it. So rather than necessarily pathologizing it to the degree that, especially at that time where, we just have nothing for these kids, her argument at that time was like, no, we need therapies for these kids. We need things for these kids. It's just a different, if we can start looking at it as a different way of thinking, we can begin to understand how to work with it. There has been pushback, of course, against this, because there's the notion that if you create too much I hate to use this word, but normalcy around something that is, from one perspective, clearly a disorder, you may then find yourself in the position of losing resources and help in situations where people clearly need it. So lower functioning autism, these kids cannot be independent, and in a lot of cases will just never be truly independent. In many, many cases, this is the case. And so, in that case, you can't look at it and go, well, that's just a different way of thinking. It's just not, right? So these are the two kind of sides of that equation, of that argument, as far as I know it. But so what about it? So you start strengthening the spleen, you start giving them these herbs, you start treating lots of scalp points, local treatment, you start doing all of these things, all of this fancy treatment. Then what's my expectation around improvements? Because look, I have never cured autism, and I'm not even necessarily, I used to think that I was like, I got to figure out a cure for autism. And then after 18 years of doing this, it's not clear to me that there is or ever will be. And part of my argument for that is the anatomical changes in the brain. Those anatomical changes, especially the older the kids get, past 8 years old, especially past 16 years old, and then certainly past early 20s, very unlikely to create a situation where that anatomy is going to change. I mean, at some point there is an age at which neuroplasticity, so even from a physiological perspective, it's just that neuroplasticity is relatively limited in those situations. So the beauty of the early diagnosis is that I'm starting to see kids younger and younger. This is a beautiful thing for me. So I'm doing lots and lots of scalp acupuncture for me. That's the local treatment For those of you who have sat with me for pediatric, local treatment is by far the most important. There's lots of fancy distal points for this, but local treatment will always trump everything in every case. Whether it's asthma, it doesn't matter what it is. Runny noses, local treatment will trump everything. It's always the most powerful treatment. Well, in autism, it's scalp treatment. So whatever you got to do to stimulate the scalp, stomach 8, gallbladder 13, do 20, Si Shen Kang, speech points, you name it, man. If there's a scalp point that sounds useful to you in this situation, it is useful to you in this situation. Scalp is so important here, and it's weird, but when you stimulate the scalp areas, the underlying areas that are under that improve. So you got multiple speech areas. And what I would probably argue is that we talked about this when we talked about ADHD, is the notion of the prefrontal cortex and the frontal lobe and its sort of intellect function and its managerial / inhibitive function for the rest of the brain in some ways is probably, in my mind, the most important area to work on. Remember when we talked about inattentive type ADHD, where they're getting a phenomenon where they're spacing out. So when they need their frontal lobe, which is the seat of the intellect, when they need their frontal lobe to crunch down on a math problem or to read or to do some homework, they're getting a phenomenon called frontal lobe turnoff, where the frontal lobe just shuts down and then they're just stuck spacing out, just staring into the void, can't get their head together. We've all experienced this. That's the frontal lobe underfunctioning. And that diagnosis of inattentive type ADHD, inattentive type ADHD, not hyperactive, inattentive type ADHD is always a spleen deficiency. So there seems to be, in my mind, a very close special relationship between the frontal lobe, specifically the prefrontal cortex, and the spleen as we know it in Chinese medicine. And so because this is a phlegm condition, we know that the spleen is the way to get at that phlegm. Well, if the spleen has a special relationship to the prefrontal cortex, this is a very rich area of discussion in autism. You can, type it into AI nowadays, and you can just look and read how the prefrontal cortex, the frontal lobe generally, and that intellect function, that managerial function, and also that inhibitive function. It's the frontal lobe inhibits the rest of the brain from being overactive. I think this probably, to my mind, is the place to put the most pressure, is on that prefrontal cortex, which is points like, I think things like yin tang, stomach 8, gallbladder 13, do 23, these kinds of points. You get into Yamamoto new scalp acupuncture that has those sort of areas up in the front of the scalp. Anything that stimulates the front of the scalp, stimulates the forehead, those areas, I think here laser therapies, and I mean expensive lasers, not cheapo lasers, real expensive lasers, really focusing on that area, strengthening that area as much as possible, stimulating that area as much as possible. This is really, in a sense, I think, for us, what we're doing, in some sense, at a very simplistic, integrative level, not to speak of enzymes and all the things that we associate with digestion, and also the relationship between the gut and the brain. And when you strengthen the digestion, gut inflammation has a tendency to go down. And this is a whole area that is rich and ripe for conversation. Why do these kids benefit from dairy-free, casein and gluten-free diets? Every autistic person has to be on that diet, or it will be quite difficult for them to improve. Very difficult. So this is an area rich for conversation, these proteins and the phlegm, all these things, right? So inflammation of the gut leading to inflammation of the brain and all of these questions, right? So but at its core, the intention of this conversation is to highlight the notion generally of Shen disorders and the nature of Shen disorders, and trying to unpack what constitutes, from a Chinese medicine perspective, Shen disorders, from a Chinese medicine perspective, not necessarily from a psychoanalytic sort of Worsley perspective about these different things, but, which I find interesting, but I'm interested in Chinese medicine the most. So how does Chinese medicine, what constitutes different kinds of insubstantial phlegm? How do they show up? And how do we start to recognize these things, let alone talk about them? you know. Then from the perspective of more of a practical conversation, like, look, this is the treatment. It's a lot of scalp stimulation, however you can get it done. This is a whole other question about pediatrics and stuff, and you can sit with me in other contexts and we can have that conversation. But at least, you have some treatment stuff. The notion of the spleen, all of these, how these things all start to relate to each other, how this relates. Anyways, we've talked about schizophrenia and sort of delusional thinking, paranoid thinking. We talk about ADHD and the obstruction factor and the notion of it getting quote unquote weird on you in the presence of insubstantial phlegm. We gave some examples of that. The notion of inattentive type ADHD and its relationship to the spleen and the frontal lobe. Now you have autism, which the banner headline of this, the diagnosis is insubstantial phlegm in the mind. When you think about autism from that perspective, everything comes together. Every single symptom you see in there can be explained in a sense by that. What about these genetic questions? All right. So the underlying genetic, I think my personal opinion, having done this for a while, is probably that the genetic mutation stuff, that's kidney deficiency underneath the surface probably, right? So then it brings up a lot of questions, but I think there's probably, most autistic kids probably have kidney deficiency under the surface. And this has been true for me many, many, many times, I think, in observing these kids and having treated over the years and seeing kidney deficiency signs in these kids who are autistic almost across the board. So, this may beg a whole separate conversation, but this being kind of the point. Anyways, okay, guys. Hope that's helpful. As always, if you have questions or things that you want to say, or you have requests or something like that, just reach out to me. I'm happy to hear from you. A number of you have reached out to me and have given me some topics to think about. But as always, you guys, take it easy and take care. All right, bye.